Hello, this is our presentation for Clinical Diagnosis and Evidence-Based Treatment, Social Work 602. Today we will be discussing transference-focused psychotherapy, presented by Darren Gish, Austin Cagle, Jack Mervin, Rhianne Orbaum, and Jordan Toon. Transference-focused psychotherapy, or TFP, is based off of the work of Otto F. Kernberg and his theory of psychoanalytic object relations theory. Transference-focused psychotherapy is considered a psychoanalytic approach, which means it places emphasis on the processing of past experiences that may have happened in childhood. This theory evolved out of the Menninger Psychotherapy Research Project for Severe Personality Disorders in 1976. The project was a culmination of 10 years of research completed by the Personality Disorder Institute at the Westchester Division of the New York Presbyterian Hospital. This being said, TFP was created specifically for borderline personality disorder or other severe personality disorders. At the time of its development, it was considered the primary treatment modality for all severe personality disorders. TFP places emphasis on the therapeutic relationship, as well as a focus on processing through internalized childhood experiences. The main objective is to modify negative behaviors and increase interpersonal relationships.
I'm Darren Gish, and I will be talking a little bit about the principles and techniques of transference-focused psychotherapy. In order to talk about the background and principles, I thought it important to find the theoretical framework that informs this psychotherapy approach. And I found that it was actually object relations theory. Object relations theory operates on the assumption that their quality of relationships, particularly within families, are predictive of potential problems later in life. The reference to objects is that the relationship exists in both the external and inner psychological world and can be negative, where unpleasant emotions are ascribed to the object, and positive, where pleasant emotions are ascribed. This theory assumes that there are two potential objects, the self and the other, primarily referred to as a parent figure, for example. As such, they're both inform the person of their identity as they're able to be the self internally, as well as experience the mother, for example, internally. So there's this kind of inner psychological representation of a mother. Early development of positive object relations is then related to the development of healthy parental attachment and seems to have a predictive factor in a person's potential development of a personality disorder. The overall focus of transference-focused psychotherapy is to help the client clarify and explore how each part of the self or other are informing their interpretation of the relationships between the self and their internal experience. Moving into the techniques of transference-focused psychotherapy, I was able to find several that Stern and Yeomans talked about, one of which is clarification of internal states. So in this way, the clinician would explore with the client the difficulties that the client is having in their lives. The client will work to help the client identify how they're experiencing themselves during the discussion, so in the session, and how they're also able to experience the clinician in sessions, so kind of starting to develop that awareness of transference. Another technique is confrontation of contradictions that are observed during the sessions. The therapist, when utilizing this technique, looks for inconsistencies and contradictions through observation of the client's nonverbal and verbal communications in session. The clinician carefully confronts these contradictions and facilitates the client in an exploration of what was going on internally during that contradicting moment. Another technique is interpretation that helps explain the divisions and links between the different states. So again, going back to the theoretical framework, we're looking at the divisions and links between those different objects. The client's guided to interpret or ascribe meaning behind why there was a contradiction and identifies the roles of self and other throughout that interpretation. Um, Transference-focused psychotherapy includes the clinician in this process. Another technique is transference analysis. Here, the clinician will intentionally introduce stressful and emotional evoking topics from the client's life and examine how the client reacts to the clinician, especially. As with contradictions, the clinician here looks for emotional presentation of the client through verbal and nonverbal communication, helping the client to explore the present emotional state and to connect to the clinician's introduction of the topic. Finally, and maybe most important technique-wise, is monitoring countertransference. The clinician is in constant internal observation of their own response to the client's transference. This internal observation is used to help the clinician understand the transferent that the client is displaying in session.
My name is Austin Cagle, and I'm going to talk a little bit about the population and setting of transference-focused psychotherapy. In TFP, there's a focus on the therapeutic relationship and explaining to the client the therapist's understanding of the particular individual's symptoms. Each person with a personality disorder may present differing symptoms, so it is important to show an understanding of that person's experience. Transference-focused psychotherapy also emphasizes helping the client comprehend the various changes in the self they may be experiencing, as well as their experience of other people. These shifts in self often play out in everyday connections as well as in the therapeutic relationship. In this way, transference-focused psychotherapy is really helpful in personality disorders such as borderline and narcissistic personality disorder. Narcissistic personality disorder shares similar features to borderline personality disorder in that they both involve a distorted sense of self. Transference-focused psychotherapy is used to recognize these distortions in order to assist clients in recognizing identity. Also, TFP focuses on the internal self, so it is able to focus on a wide range of identities that may be present with narcissistic personality disorder, such as the feelings of grandiosity, vulnerability, arrogance, entitlement, or depression. When utilizing transference-focused psychotherapy in groups, the therapist focuses on group process, as well as the rise and fall of tension within the group. An individual's self-identity may present itself during the group process, and the therapist is able to identify or address how other members of the group are affected or not affected by the tension developing in the group. The therapist is also able to detect transferences by a client toward other members of the group as a whole, and the group facilitator. Moments where clients are able to recognize this transference can be very influential in that person's understanding of their identity. Moving on to the setting of transference-focused psychotherapy. It was first developed as a model within psychoanalytic psychotherapy, and as the field has progressed, TFP has been used to introduce psychodynamic therapy to individuals who already have a basic understanding of the unconscious, internal conflict, defense mechanisms, and how these concepts relate to observable symptoms of clients. Features and principles of transference-focused psychotherapy are utilized by a good portion of therapists and psychiatric students working with clients with borderline personality disorder. And those looking to learn more about the topic are welcome to attend various conventions, lectures, and workshops, a list of which can be found on the International Society of Transference-Focused Psychotherapy's website. A great deal can be learned through this route, but it lacks the supervision provided by a full training. Official training in transference-focused psychotherapy is open to licensed psychiatrists, PhDs, and PsyDs. Those looking to obtain official training or experience in TFP must follow one of two paths. The first involves 1 to 2 years of educational trainings, such as weekly seminars or weekend workshops. Some of the established transference-focused psychotherapy centers are in locations such as New York, Quebec, Austria, Germany, the Netherlands, or Switzerland. The alternative route is to organize a group of therapists interested in learning about TFP and contact a certified TFP supervisor from one of the previous locations in order to develop a training near their own location. This usually includes 2 thorough 3-day workshops at least 6 months apart and a period of online supervision.
My name is Rayanne, and I'm going to talk about the risk and protective factors for folks who are diagnosed with a personality disorder who are most appropriate for the transference-focused therapy. So some of the risk factors that are most common for folks who have diagnosis of personality disorders is a hereditary predisposition. So they might have somebody in their family who's been diagnosed with this before, and research shows that it might make them more likely to also have a personality disorder diagnosis. Secondly is childhood stressors. So as we've learned in class and through research, that sometimes the development of personality disorders are based on stresses that occurred in childhood or skills that were not quite learned or not appropriately learned when they were younger. Specific personality traits, what that means is things that other folks might interpret as inappropriate or annoying, a lot of attention-seeking behavior, those kinds of things, poses a risk factor because often they might not be taken seriously. Other disorders is a risk factor, so the likelihood that someone with a personality disorder is also diagnosed with another disorder is very high, especially if they're qualified to seek Medicaid billable services, then they would need another disorder. The last one is engagement and risk-taking behavior. So someone who might be diagnosed with borderline personality disorder is likely engaging in self-harm behaviors. And so that, coupled with any of the other risk factors, puts them at significant risk. Some protective factors, though, are social support, which would be the same for anyone. The more support you have and the more education that your support system has in your diagnosis is beneficial to you. Clear boundaries, so if your support system helps you establish clear boundaries and you are able and confident to enforce those clear boundaries, is a protective factor. Potential insight is really important. So if you seek treatment, specifically the transference-focused therapy, you might recognize that you have a personality disorder and what that means for you and how that affects your daily life. And then lastly, there's established treatment options. So like transference-focused therapy, dialectical behavioral therapy might be an option for you, but it is a protective factor that there is research done on these personality disorders, and there is research that backs up that for some folks, depending on the personality disorder, treatment is a viable option, and there's kind of a time frame laid out of effectiveness and how to incorporate support systems into that. So folks aren't just going into treatment solely, but transference-focused therapy, like some other therapies, incorporate your whole support system. So when you leave therapy, you also have folks that can help you re-engage in those skills and coping mechanisms that you've learned in treatment. All in all, there's some risk and protective factors that would work for any diagnosis, but some of the mainstays of personality disorder, risk and protective factors is what is appropriately addressed in transference-focused therapy.
I'm Jack Mervin. I'm going to talk about what research says about transference-focused psychotherapy. Transference-focused psychotherapy is not a psychokinesis, a telekinesis, or an extrasensory perception. Transference psychotherapy is a psychoanalytical psychodynamic therapy. The types of research reviewed for this presentation were meta-analysis, independent studies, and random controlled trials. Types of interventions versus transference-focused psychotherapy include psychoanalytical and psychodynamic therapies, mentalization-based treatments, and CBT subtype dialectical behavioral therapy and schema-focused therapies. In the meta-analysis, treatment as usual was also utilized for the random control trials in the form of supportive psychotherapy. The mental health objectives compared in the studies were reflective functioning, suicidality, anxiety, strengths, weaknesses, and challenges involved with transference-focused psychotherapy mentioned in the studies for this presentation are the strength, positive increases in all symptoms, long-term results after treatment ends. Weaknesses, it's very confrontational, which leads to a high attrition rate and assumes the mental representations are present for reflection and mentalization. It is a very long-term treatment. Challenges, clients must engage in productive activities. This can cause anxiety and discontent with having to sign the contract.
In conclusion, transference-focused psychotherapy is a therapeutic intervention that was developed to help people with severe personality disorders. It includes a variety of principles and techniques found in other therapeutic disciplines. Our findings indicate that although transference-focused therapy has helpful and relevant techniques that may be somewhat effective in providing treatment to individuals with personality disorders, it may not be the most effective evidence-based treatment modality for these people. Alternatively, people with severe personality disorders may benefit from transference-focused psychotherapy treatment in conjunction with other evidence-based treatments, such as dialectical behavioral therapy. You will find all of our references on the following slide, and thank you for watching.